Good evening and welcome to Left, Right and Centre. The dengue crisis in Delhi has led to 11 deaths in the capital, and after reports of hospitals turning away patients, the Delhi government has issued a stern warning and even threatened to take action. Delhi government could cancel the license of hospitals over turning away patients. The government has also changed the corruption helpline to the dengue helpline. This after a marathon cabinet meeting in the capital that lasted more than 2 hours last night. But year after year, government after government promises to clean up Delhi, to improve healthcare facilities. All these promises are made without result. So are these just another set of empty measures, especially as the Netas are electioneering? Also on the show, the government has decided to discontinue stamps in the Builders of Modern India series featuring Indira and Rajiv Gandhi, saying they are introducing a new series called Makers of India, which will feature only 24 personalities, including Pandit Nehru, Deen Dayal Upadhyay, Jayaprakash Narayan, Shyam Prasad Mukherjee, Ram Manohar Lohia and Vallabhbhai Patel. But also, the CISF today received a new list of VIPs that will not be frisked at airports. Robert Vadra's name has been struck off that list. He's reacted saying he's happy with the ministry's orders, but the Congress is screaming political vindictiveness on both counts. Are these a necessary focus for the government, or are bigger priorities falling victim to trivial politics? But first on the show tonight, Delhi battles a severe outbreak of dengue. Hospitals are seeing unending queues of people, up to 3 patients occupying a single bed, with 3 times the number of patients as there are beds. Doctors have advised patients to come to the hospital only when they have severe symptoms. The Delhi government has also said that no private clinic can charge more than 600 rupees for a dengue test. Meanwhile, as a medical crisis unfolds, as we said, politicians are busy electioneering.
This is where Aman lived. These are the surroundings in which he was bitten by a dengue mosquito. Everywhere there is filth, open gutters. A perfect breeding ground for the killer disease.
Fogging बिल्कुल नहीं होता है यहाँ पे. अमन के जाने के बाद एक फॉर्मेलिटी के लिए थोड़ी देर के लिए गाड़ी घुमाई है, हल्का सा. उसके बाद कोई फोगिंग करने नहीं आया, ना ही कोई देखने आया कि हाँ भी मच्छर पनपते हैं. आज हाँ थोड़ा सा सफाई वगैरह हो रही है, वो अमन जाने के बाद.
मीडिया के आने के बाद ये सारी एक्टिविटीज़ दिखला रही है गवर्नमेंट, चाहे गवर्नमेंट किसी की भी हो, लेकिन जन समूह के लिए जो अच्छे काम होने चाहिए वो नहीं हो पा रहे हैं.
कोई नहीं आता यहाँ पे, कोई देखने नहीं आता, सब ऐसे ही चल रहा है यहाँ पे.
Over 1,800 people have been affected and 11 deaths reported. In the last 48 hours, from state to the centre, statements have been made and steps to be taken announced. But when dengue comes back to bite Delhi every year, why wasn't Delhi prepared? The Aam Aadmi Party has spent an almost 520 crores on ads promoting themselves. Wouldn't this money have been better spent on ensuring Delhi was dengue free? Or there were enough beds and staff to ensure no one turned away? And what about the key men responsible? From the Chief Minister to the many AAP leaders, most were busy campaigning in Delhi University polls. And Mr. Nadda, the Union Health Minister, has been busy with Bihar elections.
It is utter lack of planning, coordination between the Delhi government and the MCD, and the inefficiency of both the MCD and the Delhi government which has resulted in this kind of situation.
पुराने डाटा के हिसाब से 3 गुना इंतजाम कर लिया गया. हमने सारे डिपार्टमेंट जिनकी जिम्मेदारी थी प्रिवेंशन के लिए, घर घर जाने की जिम्मेदारी, उनको इंस्ट्रक्शन दे दी गई, उनको बता दिया गया, बार बार उनसे रिव्यू कर लिया गया. आज आप कह रहे हैं कि नहीं जी एग्जैक्टली इतना नंबर क्यों है, इसके भी बता देते हैं आपको. इतने ज़्यादा नंबर नहीं है जितना ज़्यादा पैनिक फैल चुका है. आज पैनिक की वजह से एडमिशन ज़्यादा है.
And it's not just the area where Aman stayed. We currently come to you from Nizamuddin, where it's as filthy and dirty. And locals here say nobody has come in here despite there being a dengue endemic, nor has the MCD carried out any fumigation drive. On one hand, the Delhi government says they've started with an SMS awareness campaign. The municipal corporation say they are putting up hoardings. But a lot more needs to be done to ensure that no more Amans and Avinashis lose their battle to dengue yet again. In New Delhi with camera person Bala and Manoj Thakur, I'm Sonal Mehrotra, NDTV.
This is one of Delhi's most prominent government hospitals, the Ram Manohar Lohia Hospital. And today its emergency ward resembles a crowded railway platform.
4-year-old Angel Chauhan has had dengue for the last 3 days and is currently on a drip. His father cradles him as he makes his way inside the hospital, hoping he will find a bed for his son. 3 patients on 1 bed. These are pictures from the RML hospital where a number of patients have been coming in to get treated for dengue. Amit Kumar and Prasad lie next to each other on this narrow bed. They are lucky to have been able to get some space on a bed and not a stretcher. They've never met each other before, but the overwhelming rush of patients has meant they now share the same diagnosis and the same hospital bed.
आप रिश्तेदार नहीं हैं?
जी नहीं पेशेंट हैं।
पेशेंट
जी पेशेंट।
अच्छा, तो एक बेड पे 2-2 लोगों को भी रखना पड़ रहा है?
जी है, ये आप देख ही रहते हैं।
With every bed here already occupied, even stretchers are now doubling up as beds in this special emergency ward for dengue. Ironically, NDTV found these extra beds lying in a storeroom of Aruna Asif Ali Hospital. The government could only assure us something would be done.
मैंने जितने भी हॉस्पिटल में जितने भी बेड हैं, सभी बेड्स को कह दिया कि आप जहाँ भी खोल सकते हैं खोल लीजिएगा, यूज कर लीजिए.
The real heroes are doctors and nurses working round the clock. With all leave being cancelled, many of them working multiple shifts without a break.
गवर्नमेंट हॉस्पिटल में वी आर मेंटली एंड फिजिकली प्रिपेयर्ड हो ही जाते हैं हम लोग कि हमें these kind of patients we have to handle, but only the thing is that we have a less manpower.
This year the cases are more. In 2010 we had around 1600 cases in total, but this year it has gone to 1800, more than 1800.
Though Delhi has seen the highest number of dengue cases over the last 5 years, there is no respite expected anytime soon. And with the surge in patients and in panic, the dengue pressure on the health system will not ease for the next few weeks. In New Delhi, Ketki Angre for NDTV.
Well, what can Delhi do about this possible epidemic of dengue? We're being joined in the studio by Dr. Vikas Vajpayee, the Assistant Professor for the Center of Social Medicine and Community Health at Jawaharlal Nehru University. The Aam Aadmi Party's Raghav Chadha joins us. The BJP's GVL Narasimha Rao. We're also hoping for Dr. Randeep Guleria of AIMS to join us, the head of pulmonary medicine there, in a short while. But I want to actually start with Raghav Chadha. Raghav, the Aam Aadmi Party government seems to have allocated over 4,700 crore rupees towards healthcare. Where is all this money? Why are we seeing this kind of situation where there are 3 patients per bed in a hospital right now?
Yes, Maya, you're right that the government of NCT of Delhi had given a 150% hike to its budgetary allocations towards healthcare. Let me put this meaningful discussion into perspective before I answer your question. The entire widespread of dengue disease has 2 aspects. One is the preventive aspect and the other is the curative aspect. The preventive aspect involves sanitation, conservancy, fumigation, etc., for which there is another authority that is responsible. As far as the treatment curative action is concerned, there are multiple organizations and institutions functioning. There are about 40-45,000 doctors in Delhi, more than 900 private hospitals, more than 40 Delhi government-run hospitals and 30 central government-run hospitals. As far as the alertness and the preparedness of the government of Delhi goes, with respect to the government of Delhi-run hospitals is concerned, we had anticipated that due to the cyclical nature of this disease, there will be a spurt in the number of dengue cases this time around. Last time around 1,200, last year around 1,100, 1,200 such cases were reported, and we were expecting that this number could become double or triple. And therefore, since the day we assumed office, we have hit the ground running. We have increased the number of beds by a whopping 300% to what it was last year. We have made adequate arrangements for free medical tests and medicines in the Delhi government and hospitals. We have cancelled the leaves of all doctors and paramedical staff. We are using the elective surgery rooms for dengue cases and deferred their surgeries. We have started with fever clinics. We have also capped the fee that these private hospitals were an exorbitant amount of fee that they were charging for dengue tests. So there have been many steps that the government of NCT of Delhi has taken.
Right.
And in my defense, I can only say this, that yes, while I agree that there is scope for improvement, there is room for improvement, but it's a 2-pronged approach.
Right,
there has to be preventive action as well as curative action.
All right, I'll come back to you because what I'm going to ask Mr. Narasimha Rao of the BJP is also something that the Aam Aadmi Party will have to answer for. Sir, the Health Minister, JP Nadda, has been campaigning in Bihar for the elections. Don't you think that his attention and his priority should be currently focused on what's clearly a healthcare scare in the capital of the country?
I think I can only say that your information is completely incorrect. Mr. Nadda is giving his full-time attention to his ministry, that is the health ministry, not only now, but he had actually been coordinating with various state governments, including state government of Delhi from April onwards on the possible outbreak of dengue and the kind of support that the center can assist them. So the center had been doing everything possible in its command, but it's largely the state government which is actually acting now is only giving out knee-jerk reactions. A lot of preparatory work ought to have been done. Because dengue is a seasonal outbreak. It happens during monsoon months. This was very much on the radar. They were the self-obsession of the Aam Aadmi Party to promote its own campaign. One thing that the AAP representative did not mention was the need to communicate to the people of the state the kind of preventive steps that they need to take.
Okay, before I bring in the medical experts,
I think they were wanting in this respect.
All right, before I bring in the medical experts, sir, if I could just ask you as well, you know, two questions really. One, what can the center do to enforce that the measures that you're announcing today are going to be implemented by the state as well at the state level hospitals? What about the issue of sanitation in Delhi? The MCD, we know there's always a sort of, you know, a blame game that goes on between Delhi government and the MCD and the kind of political differences that come up between them. Ultimately, the center and the state have to work together because there's no point pointing fingers, is there? People are dying. Mr. Narasimha Rao, could you hear the question?
Yeah.
Yeah, go ahead.
Yeah, can you repeat that?
Yeah. No, I'm just asking you, how can the center actually enforce and implement certain measures that it needs to take with the state, whether it's Delhi or anybody else, given that there is this healthcare scare around, the issue of political differences between...
Maya,
yeah, go ahead, sir.
Center cannot enforce. I think center can provide all necessary assistance to the state government, and that the central government had been doing from April onwards. There have been 12 advisories that were sent about this. There were some 26 review meetings that were held with the Delhi government since April this year, in the last 6 months. And also all the vaccines that are required, the vaccine kits have been provided, and sentinel centers had been set up. So there is absolutely, from the center, the line was very clear. Please take all necessary preventive care, and any assistance you require from the center, do let us know.
All right.
To the best of my knowledge, there is nothing that had been sought by the state government that had not been provided.
Okay, all right.
Certainly, it's a response of the health being a state subject. It's primarily the responsibility of the state government.
Health is a state subject, sanitation under the
assist in all situations.
You know, Delhi is always running around in the same crisis. Raghav, very quickly respond, because I want to get Dr. Guleria and Dr. Bajaj into the Dr. Bajpai into the discussion as well.
Maya, it is unfortunate that the representative from another political party on your panel is trying to politicize this issue and play a political blame game. I will refrain from behaving in an irresponsible and an insensitive manner on your panel, and I have already stated that at all levels, the central government, the government of Delhi, as well as the local authorities have to work hand in hand, because the situation in Delhi is a complex one. The healthcare situation in Delhi is operates at multiple levels. There are central government run hospitals, there are MCD run hospitals, and sanitation is fairly and squarely the responsibility of the MCD. Therefore, we have to work in cooperation rather than playing this ugly political blame game. Today is not that day, and this is not the occasion to play politics.
There is not the occasion to play politics. I think our medical experts on the panel are definitely going to agree. Dr. Bajpai, I'd like to ask you, because, you know, community health is something that you look at as well. Now, a disease, an illness like dengue ties into so many aspects of healthcare, sanitation, civic responsibility, citizens' initiatives. How is Delhi going to contain this?
See, first of all, I'd like to highlight the problem of tragedy of public health is that we remember it only when some innocent lives are lost. Last that we talked seriously about this, including in media, was when the sterilization deaths took place in Chhattisgarh. So, but the fact remains that the groundwork for such kind of tragedies is laid in the intervening period which goes by. And I'd like to comment on what Mr. GVL was telling about. You see, in Delhi, as per the health minister yesterday, he was speaking on your program, there are 50,000 beds, of which 20,000 of them, they are with central government. 20,000 are with private sector. Okay. So, I mean, central government cannot wash its hands away. Okay. It is providing substantial part of healthcare in Delhi. Moreover, it's really tragic. I mean, the representative of Aam Aadmi Party is here. I don't know what kind of review meetings they hold, what do they do in those review meetings. They cannot make these private hospitals comply to provide care for the dengue patients. I mean, so many of them, they have they've used huge public subsidies. Apollo and all those kinds. They have beds for poor patients and all. Why can't they just post their officers over there who would ensure that all these kind of? But I mean, it doesn't take a lesser mortal like me to be suggesting it. If they are concerned about this and all the things, they ought to have been taking.
Dr. Guleria, come in on this, because you know you're with the All India Institute of Medical Sciences. This issue of the centre washing its hands off responsibility, there's a couple of aspects. One, of course, as Dr. Bajpai has been pointing out, that they have a certain number of beds under their control. The second is, this is something that keeps happening time and time again every time there is a public health issue that takes place, because we're talking about review meetings, we're talking about funds that have been allocated, policies that have been put in place, but it seems to just be talk.
Exactly. You know, in my opinion, we need to, this is something which we need to plan way before it happens. We know every year during the monsoon months this is going to happen. We need to have some sort of an outbreak management system out there, which is basically going to involve hospitals which may be under the center, which may be under the state, which may be in the public sector or the private sector. And we need to have some sort of a plan so that we say, okay, if there is an outbreak, no matter what be the outbreak, it could be dengue, it could be swine flu, it could be some major earthquake, that we are able to quickly increase the number of beds. We designate hospitals that these will suddenly stop routine admissions, they will increase the number of beds, double the number of beds. You even divide hospitals zone wise, that these are patients who are, say, in North Delhi will go to these 5 or 10 hospitals, in East Delhi will go to these 5 and 10 hospitals. These hospitals cannot refuse admissions. They may be public hospitals, they may be private hospitals. If you have a plan in place, and then you have to have a sort of a protocol in place. I'll give you an example. For example, in 2009, we started off by saying we'll admit all patients who have a platelet less than 1 lakh.
Right.
We realized that we will not be able to do that. There was too many patients coming in. So we decreased the cutoff, but we kept those patients under close follow-up. We asked them to come in the morning and the evening. We told them about the warning signs of dengue. Dengue, by and large, in majority of patients, is a mild illness, and the panic is not really required.
It's not warranted.
What you need to do is watch out for those patients who have warning signs, whose platelet counts are coming down, who have pain abdomen, vomiting, who are having features of shock syndrome, and they should be admitted